Guys, this is Dr. Arusha Campbell Chambers, dermatologist and founder of Dermatology Solutions and author of the best-selling book, Laugh, Love, Glow. I am going to be speaking to you this week about hyperpigmentation, okay? And we're going to look at the different causes of hyperpigmentation. It's actually one of the most common problems that we see presenting to us, particularly in populations where there are a lot of persons of color, okay? And as the name suggests, hyperpigmentation, it is basically when there are patches of the skin where there is increased pigmentation or darkening of the skin. Commonly, this is caused when, for one reason or the other, there's too much of melanin being produced. Now, melanin, all right, which I'm sure many of you know, is the pigment that gives your skin its color. Okay, and it is produced by a particular cell in the skin called the melanocyte. And there are many different reasons why you can have different disorders of pigmentation, in particular hyperpigmentation. One very common cause that we see almost every day in practice is called post-inflammatory hyperpigmentation. And this occurs when there is increased pigmentation or darkening of the skin following anything that causes inflammation to the skin. So for example, you may see dark spots left behind from acne, dark spots left behind from eczema, dark spots left behind from a burn. Many different skin conditions can leave the area darker behind, and we call this post-inflammatory hyperpigmentation. Another cause of hyperpigmentation is melasma, okay? And that tends to present more commonly in women with brown patches and commonly on the face, but it can occur in other body areas, and this occurs when there is increased pigment production. Later on in the week, I'll go into more detail about all the different factors that contribute to melasma, but I just want you to be aware that there are different reasons why you may have different types of pigmentation happening, okay? Another form, freckles, right? And what people call age spots, a fancy name for that, is solar lentigines, which are triggered by the sun in particular, where you have these brown spots on the skin. And these we can see very commonly in certain persons from time to time. Another cause as well is where you have a darkening of the skin, particularly in, let's say, the cheeks or the back of the neck. And this is also accompanied by a thickening of the skin, and this presents as acanthosis nigricans, and that is often associated with underlying conditions or genetics. All right, so that's another one I'll get into later on, perhaps this month. In addition to that, now, you can actually have causes of increased pigmentation by medications, and we call this a fixed drug eruption. So there are some medications that after taking them, you see a particular dark spot in a particular area, and we call that a fixed drug eruption. So there are many different causes. You have persons being born with dark spots like birthmarks, and there are many different types and patterns of birthmarks. And you can have pigmentation that isn't melanin, but it gives a darker hue, and there are many different underlying causes of this, including, liver disease, kidney disease, drug-induced, and many other causes. All right, so this is just a taste to let you know that there are different reasons why you may see dark spots appearing. Later in the week, I'll go into the different causes. I'll tell you a bit more information about who gets it and so forth. And then later in the month, we'll discuss how we treat it. We look at each of the different types of treatments and prevention methods that you can use to help treat those dark spots and get your glow on. There's more information about skincare and other skin diseases on our website, www.mydermatologysolutions.com. And if you haven't read it, you can check out my book, Laugh, Love, Glow, available on Amazon, okay? And also at Dermatology Solutions, Montego Bay. In Antigua, it's available as well in the Best of Books bookstore, and in St. Vincent at KMK Innovation, as well as at PR Campbell and Company. So that's all for now. Have a great day. Take care. And remember to keep glowing, protect your skin, use the